Nursing management primarily deals with option A, direct to patient care only. Option B, planning, organizing, directing, and controlling nursing services. Option D, teaching only. Option D, hospital finance. The correct answer is option B, planning, organizing, directing, and controlling nursing services. Nursing management focus on administrative functions to ensure quality care and efficient service delivery. Nursing management primarily deals with planning, organizing, directing, and controlling nursing services. Second question. The process of setting goals and deciding how to achieve them is called option A, planning. Option B, organizing. Option D, directing. Option D, evaluating. The correct answer is option A, planning. Planning involves deciding objectives and determining strategies to achieve them. Process of setting goals and deciding how to achieve them is called planning. Planning involves deciding objectives and determining strategies to achieve them. The principle of management division of work was given by option A, Max Weber. Option B, Elton Mayo. Option C, Henry Foyle. Option D, Florence Nightingale. The correct answer is Henry Foyle. Henry Foyle developed 14 principles of management, including division of work. The principle of management division of work was given by Henry Foyle. Henry Foyle developed 14 principles of management, including division of work. Which leadership style gives full authority to the leader and little participation to subordinates? Option A, democratic. Option B, autocratic. Option C, laissez-faire. Option D, transformational. The correct answer is option B, autocratic. In autocratic leadership, decisions are made by leader with minimal input from staff. In autocratic leadership, decisions are made by the leader with minimal input from staff. Which type of leadership is considered most effective in nursing management? Option A, autocratic. Option B, democratic. Option C, laissez-faire. Option D, dictatorial. The correct answer is option B, democratic. Democratic leadership involves participation, teamwork, and motivates staff effectively. Democratic leadership involves participation, teamwork, and motivates staff effectively. The span of control in nursing management means option A, number of hours of duty. Option B, number of subordinates directly supervised by a manager. Option C, nurse to patient ratio. Option D, hospital beds available. The correct answer is option B, number of subordinates directly supervised by a manager. Span of control refers to how many employees a manager can effectively supervise. Span of control in nursing management means number of subordinates directly supervised by a manager. Next question. In Maslow hierarchy, the highest level of need is option A, safety needs. Option B, social needs. Option C, esteem needs. Option D, self-actualization. The correct answer is option D, self-actualization. Self-actualization is achieving one's full potential, the highest level of Maslow hierarchy. The process of assigning duties to subordinates is called option A, delegation. Option B, supervision. Option C, coordination. Option D, motivation. The correct answer is option A, delegation. Delegation transfers responsibility and authority to subordinates to perform tasks. The process of assigning duties to subordinates is called delegation. Delegation transfers responsibility and authority to subordinates to perform tasks. The controlling function in nursing management involves option A, only checking staff attendance. Option B, measuring performance against standards. Option C, teaching student nurses. Option D, writing reports only. The correct answer is option B, measuring performance against standards. Controlling ensures actual performance matches planned objectives. Measuring performance against standards is a controlling function in nursing management. Which of the following is an example of in-service education? Option A, continuing nursing education workshop. Option B, school classroom lecture. Option C, BSc nursing program. Option D, patient health education. The correct answer is option A, continuing nursing education workshop. In-service education updates practicing nursing skills and knowledge. Continuing nursing education workshop is an example of in-service education. In-service education updates practicing nurses skill and knowledge. Motivation in nursing management is important because it option A forces staff to work, option B improves performance and satisfaction, option C reduces workload, option D replaces supervision. The correct answer is option B improves performance and satisfaction. Motivation encourages employees to work effectively and happily. Motivation in nursing management is important because it improves performance and satisfaction. Time management for nurses mainly helps in option A reducing patient care quality, option B effective utilization of time and resources, option C increasing overtime, option D avoiding delegation. The correct answer is option B effective utilization of time and resources. Proper time management improves productivity and reduces stress. Time management for nurses mainly helps in effective utilization of time and resources. Proper time management improves productivity and reduces stress. The best method to resolve conflicts in a nursing team is option A avoidance, option B collaboration, option C forcing, option D ignoring. The correct answer is option B collaboration. Collaboration seeks win solutions and maintains harmony. The best method to resolve conflicts in nursing team is option B collaboration. Which budget is prepared for day-to-day nursing unit expenses? Option A capital budget, option B revenue budget, option C zero based budget, option D performance budget. The correct answer is option B revenue budget. Revenue budget covers daily operational expenses like salaries and supplies. Revenue budget covers daily operational expenses like salaries and expenses. The principles the principle of unity of command means option A one nurse can report to many supervisors. Option B every employee should receive order from only one supervisor. Option C staff can take orders from anyone. Option D patients are commanded by nurses. The correct answer is option B every employee should receive orders from only one supervisor. Unity of command prevents confusion and conflicting orders. The principle of unity of command means every employee should receive orders from only one supervisor. The process of forecasting manpower needs in nursing is called option A recruitment, option B staffing, option C scheduling, option D planning. The correct answer is option B staffing. Staffing ensures the right number and type of personnel are available. The process of forecasting manpower needs in nursing is called staffing. A nursing round is conducted mainly to option A supervise students only, option B provide group teaching and patient care discussion, option C take patient attendance, option D reduce nurse workload, option B provide group teaching and patient care discussion. Nursing rounds helps in teaching, improving care and solving problems collectively. A nursing round is conducted mainly to provide group teaching and patient care discussion. Which inventory control technique uses ABC analysis? Option A cost accounting, option B material management, option C financial budgeting, option D hospital statistics. The correct answer is option B material management. ABC analysis categorizes items into high, medium and low value for inventory control. Material management is inventory control technique uses ABC analysis. It categorizes items into high, medium, and low value for inventory control. Which is not a function of nursing management? Option A planning, option B organizing, option C patient diagnosis, option D controlling. The correct answer is option C patient diagnosis. Diagnosis is not a clinical role, not a diagnosis is a clinical role, not a management function. Which is not a function of nursing management? Patient diagnosis is not a management function. The diagnosis is a clinical role. The principle of management esprit de corps means option A division of work, option B unity and team spirit, option C authority and responsibility, option D chain of command. The correct answer is option B unity and team spirit. Esprit de corps emphasizes moral and team cooperation. The principle of management esprit de corps means unity and team spirit. Quality assurance in nursing ensures option A reduction of nursing staff, option B standardized safe and effective nursing care, option C low cost treatment, option D quick discharges. The correct answer is option B standardized safe and effective nursing care. Quality assurance evaluates and improves nursing services. Quality assurance in nursing ensures standardized safe and effective nursing care. The most common tool for the patient classification in nursing management is the most common tool for patient classification in nursing management is option A bed occupancy rate, option B acuity index, option C hospital census, option D admission register. The correct answer is option B acuity index. Acuity index classifies patient based on care needs and nursing overload. Acuity index classifies patient based on care needs and nursing workload. In delegation, the ultimate responsibility remains with option A subordinate nurse, option B nursing superintendent, option C the person who delegates, option D the patient. The correct answer is option C the patient who delegates. In delegation, the ultimate responsibility remains with the person who delegates. The manager delegates authority but remains accountable. Incident report in nursing are written to option A record routine patient care, option B document unusual events like falls, errors or injuries, option C report nurse's absence, option D replace patient's note. The correct answer is option B document unusual events like falls, errors or injuries. Incident reports help improve safety and prevent reoccurrence. The process of guiding, supervising, and directing staff is called option A leadership, option B controlling, option C organizing, option D planning. The correct answer is option A leadership. Leadership involves influencing and motivating staff to achieve goals. The process of guiding, supervising, and directing staff is called leadership. It involves influencing and motivating staff to achieve goals. Gantt chart in nursing management is used for option A patient records, option B time and activity scheduling, option C inventory control, option D budgeting. The correct answer is option B time and activity scheduling. Gantt chart is a visual tool for planning and scheduling tasks. Gantt chart in nursing management is used for time and activity scheduling, is a visual tool for planning and scheduling tasks. The grievance redressal mechanism in hospital is mainly for option A patient only, option B nurses only, option C staff and patients, option D doctors only. The correct answer is option C, staff and patients. Grievance systems addresses concerns of both employees and patient. The redressal mechanism in hospital is mainly for staff and patient. The principle of accountability in nursing management means option A, nurses are free from responsibility. Option B, nurses are answerable for their actions. Option C, doctors are responsible for nurses. Option D, patients are accountable for treatment. The correct answer is option B, nurses are answerable for their actions. Accountability ensures professional responsibility in nursing care. The principle of accountability in nursing management means nurses are answerable for their action. The process of selecting the right candidate for a job is called option A, staffing. Option B, recruitment. Option C, selection. Option D, orientation. The correct answer is option C, selection. Selection involves choosing the most suitable candidate after recruitment. The process of selecting the right candidate for the nursing job is called selection. It involves choosing the most suitable candidate after recruitment. The Hawthorne experiment highlighted the importance of option A, money in motivation. Option B, social factors and human relations in productivity. Option C, strict supervision. Option D, long working hours. The correct answer is option B, social factors and human relations in productivity. Elton, Moyers, Hawthorne studies show that employees' moral and relations improve performance. The Hawthorne experiment highlighted the importance of social factors and human relations in productivity. In nursing management, orientation programs are designed for option A, new patients. Option B, newly recruited staff. Option C, senior doctors. Option D, hospital visitors. The correct answer is option B, newly recruited staff. Orientation help new employees adapt to organization policies and culture. In nursing management, orientation programs are designed for newly recruited staff. Which management function comes immediately after planning? Option A, controlling. Option B, directing. Option C, organizing. Option D, staffing. The correct answer is option C, organizing. Organizing arranges resources and activities to implement plan. Which management function comes immediately after planning? Option C, organizing. Organizing arranges resources and activities to implement plan plans. The nurse to patient ratio in ICU recommended by INC is option A, 1 is to 1. Option B, 1 is to 2. Option C, 1 is to 3. Option D, 1 is to 5. The correct answer is option B, 1 is to 2. INC recommends one nurse for every 2 ICU patients. INC recommends one nurse for every 2 ICU patients. Budgeting in nursing management is important because it option A, creates financial stress. Option B, helps in proper allocation of resources. Option C, reduces staff recruitments. Option C, option D, replaces planning. The correct answer is option B, helps in proper allocation of resources. Budget ensures funds are available for smooth functioning. Budgeting in nursing management is important because it helps in proper allocation of resources. Which management approach emphasizes that a satisfied worker is a productive worker? Option A, bureaucratic theory. Option B, human relations approach. Option C, scientific management. Option D, systemic approach. The correct answer is option B, human relations approach. It focuses on motivation, teamwork, and employee satisfaction. Human relation approach emphasizes that a satisfied worker is a productive worker. Which is an example of capital budget in nursing? Option A, nurse's salary. Option B, purchase of hospital building. Option C, utility bills. Option D, medical supplies. The correct answer is option B, purchase of hospital building. Capital budget is for long-term investments like land, building, and equipment. Capital budget is for long-term investment like land, building, and equipments. A nurse audit is conducted to option A, evaluate patient satisfaction only. Option B, assess the quality of nursing care provided. Option C, count number of beds used. Option D, check hospital accounts. The correct answer is option B, assess the quality of nursing care provided. Nursing audit measures quality, effectiveness, and outcome of nursing care. A nursing audit is conducted to assess the quality of nursing care provided. It measures quality, effectiveness, and outcome of nursing care. The span of supervision depends on option A, nurse's age. Option B, patient wishes. Option C, nature of work and staff competency. Option D, hospital building size. The correct answer is option C, nature of work and staff competency. More complex work requires smaller spans of supervision. Nature of work and staff competency. More complex work requires smaller spans of supervision. The process of motivating employees with rewards and recognition is called option A, job description. Option B, incentive management. Option C, punitive control. Option D, delegation. The correct answer is option B, incentive management. Incentives encourage better performance and staff satisfaction. The process of motivating employees with rewards and recognition is called intensive incentive management. Which management theory emphasizes one best way of doing work? Option A, scientific management. Option B, bureaucratic theory. Option C, systems theory. Option D, behavioral theory. The correct answer is option A, scientific management. Taylor's scientific management emphasized efficiency through standardization. Which management theory emphasizes one best way of doing work? Scientific management. A nursing care standard is defined as option A, minimal requirement of care expected. Option B, maximum workload for nurses. Option C, hospital's financial plan. Option D, patient satisfaction survey. The correct answer is option A, minimal requirement of care expected. Standards define minimum acceptable level of nursing care. The main aim of staff development programs is to option A, reduce salaries. Option B, enhance knowledge, skills, and professional growth. Option C, replace formal education. Option D, save hospital cost. The correct answer is option B, enhance knowledge, skills, and professional growth. Staff development maintains competence and prepares nurses for higher roles. The main aim of staff development programs is to enhance knowledge, skills, and professional growth. Staff development maintains competence and prepares nurses for higher roles. An organization chart in nursing management shows option A, patient treatment plan. Option B, structure of authority and responsibility. Option C, hospital budget. Option D, staff duty roster. The correct answer is option B, structure of authority and responsibility. An organizational chart in nursing management shows structure of authority and responsibility. It visually represents hierarchy and relationship. A democratic nurse manager encourages option A, independent decision making without consultation. Option B, staff participation in decision making. Option C, blind obedience. Option D, punitive supervision. The correct answer is option B, staff participated in decision making. Democratic leadership is participatory and cooperative. A democratic nurse manager encourages staff participation in decision making. Job description for nurses mainly include Option A, patient's medical history. Option B, roles, responsibilities and duties expected. Option C, hospital finance details. Option D, patient's admissions detail. The correct answer is option B, roles, responsibilities and duties expected. Job description clarifies expectations and accountability. Job description for nurses mainly includes roles, responsibility and duties expected. It clarifies expectations and accountability. The performance appraisal system in nursing evaluate. Option A, nurses salary. Option B, nurses job performance and competencies. Option C, patient's progress. Option D, nurses attendance only. The correct answer is option B, nurses job performance and competencies. Performance appraisal identifies strengths, weakness and training needs. Performance appraisal identifies strength, weakness and training needs. A good leader in nursing management should have option A, authoritarian control. Option B, good communication, motivation and decision making skills. Option C, strict punishment methods. Option D, financial expertise only. The correct answer is option B, good communication, motivation and decision making skills. Leadership in nursing is based on guiding, inspiring and influencing staff. A good leader in nursing management should have good communication, motivation and decision making skills. Leadership in nursing is based on guiding, inspiring and influencing staff. Strategic planning in nursing management focus on option A, short-term daily goals. Option B, long-term goals and policies. Option C, bedside care only. Option D, staff duty rosters. The correct answer is option B, long-term goals and policies. Strategic planning in nursing management focus on long-term goals and policies. Strategic planning deals with future-oriented objectives. The best method to prevent burnout among nurses is option A, increasing work hours. Option B, providing counseling, rest and staff support. Option C, reducing salaries. Option D, strict supervision. The correct answer is option B, providing counseling, rest and staff support. Preventing burnout ensures nurses' mental health and productivity. The best method to prevent burnout among nurses is providing counseling, rest and staff support. The main purpose of nursing management is to reduce patient admissions, ensure quality nursing care and efficient use of resources. Option C, replace doctors in hospital. Option D, focus only on paperwork. The correct answer is option B, ensures quality nursing care and efficient use of resources. Nursing management aims for effective care delivery and staff satisfaction. Nursing management aims for effective care delivery and staff satisfaction. Thank you all.